Welcome to the BioBalance Healthcast, episode 685. Questions you are too embarrassed to ask your gynecologist.
BioBalance Healthcast features conversations about anti-aging medicine. Your host is Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging. Dr. Maupin is the author of The Secret Female Hormone, the seminal work about testosterone replacement therapy for women, and Got Testosterone, the award-winning book for men that helps men choose the most effective and safe form of testosterone replacement. These books are available on Amazon or from Dr. Maupin's office at BioBalance Health in St. Louis and in Kansas City. Dr. Maupin's office is currently accepting new patients.
Welcome to the BioBalance Healthcast. I'm Dr. Kathy Maupin. My practice is BioBalance Health. I am going to talk about a subject that has some sexual content. It is medical sexual content, and there are no pictures. So if you're nervous or worried about sexual content, then please don't watch or listen. And we'll pick up in a couple weeks when we are on another subject. But we're going to have 2 weeks of answering the questions that patients were too afraid or too embarrassed to ask me. So this week, I have always had many questions about this in and out of the office. Even in my social sphere, people have pulled me to the side and say, this is happening to me. And it is about having a different vaginal smell, okay? So you have to understand that everybody knows what they smell like. You know what you smell like when you sweat. You know what you smell like. Basically, it's not bad. It's not offensive. We all get used to our own bodies as we grow up. But hardly anybody knows what causes us to smell a certain way or not smell a certain way. So basically, I'm going to just give you a little background. Vaginal smell has to do with the bacteria that grow in and around the vagina. The bacteria is different than the bacteria that grows in your intestines, but there are some similarities because they're very close. They can contaminate each other. But in general, the bacteria in the vagina are meant to protect you. And those bacteria sometimes get disrupted by medical treatment, like antibiotics can disrupt it, or a cortisone, a prednisone series, or a cortisone shot. All of those things can disrupt the vaginal mucosa and have all those bacteria, the good ones die and the bad ones show up. Usually we see yeast infection, yeast overgrowth when the good bacteria, it goes away. The other thing that affects that bacteria is the stage in life we are. There's very little odor to girl children's underwear. They don't have much odor because they don't have estrogen, they don't have testosterone, they don't have progesterone, and they don't have any bleeding. They don't have periods. So there's very little bad odor, and basically they just seem very clean. And that's how children are supposed to be. They can get infections too, usually by wiping the wrong way, but that's a whole nother talk. As we get older, as we start to have periods, because we have periods, the blood causes different kinds of bacteria to be more prevalent while we're having our period and right after. So the odor is more like iron or like blood or like old blood. It doesn't smell pleasant. And oftentimes that is something that just has to take a couple days to go away when the good bacteria comes back. As we get into our reproductive years, our estrogen goes up. We have a lot of estrogen. Estrogen causes different bacteria to grow than people who don't have estrogen. People who are on the pill have a different vaginal odor than people who aren't on the pill. And people who aren't on the pill have a different odor all through the month because they have different hormones going up and down. The pill shuts down that rise and fall of estrogen, testosterone, and progesterone and keeps it very quiet. So it's a different situation. People have always asked me, women have always asked me, I went off the pill and now I have this different smell and I don't get it, and what is this? Well, all that is just a different normal bacteria that occurs when you have more estrogen and more testosterone. The last change is at menopause if you don't replace your hormones. If you don't replace your hormones, there is no estrogen, there's no testosterone, there's no progesterone, and the vaginal area dries up. It basically doesn't have any wetness, so the bacteria change. And generally, the protective bacteria that is promoted by estrogen and testosterone and progesterone aren't there anymore. So generally, there is I call it a nursing home odor to the vagina of people who are menopausal for several years and after, if they don't replace any hormones. Sometimes it even smells a little like urine. But that's also because as you lose your estrogen, you also lose the estrogen effect on the bladder. The bladder then gets kind of relaxed and you don't hold urine as well. So there is usually a urine smell associated with people who are menopausal. This is from somebody who spent 29 years between stirrups looking at people's vaginas. That's what gynecologists do. So we had to always note whatever we saw. Basically, we had to be good describers of what was going on. And generally, I'd tell the patients if they had an infection or if we needed to give them probiotics to change the bacteria. So all in all, that's kind of how the science behind it. But if we're just going to talk about people walking up to me, friends, and people I know as acquaintances and saying, hey, I got to ask you this question. I'm really embarrassed to ask my doctor, so I'm going to ask you. And they'll say, I got this weird odor. So I compiled a list of weird odors, because the next question is, what does it smell like? So the weird odors consist of, smells like yeast or baked bread, sweaty like body odor, sour like a towel that's been wet and left in a closed area too long, it gets sour. Musky is basically a sexual smell for animals and people, like urine, like a nursing home, or like something is dead in there. I've heard that before, and like fish. It smells fishy. So I'm going to go over the last two first. The last two can be something serious. So I think in case any of you decide not to listen to anything else, I want you to listen to this. If your vagina smells foul or like something is dead or something's breaking down in terms of not being alive anymore, that could be one of two things. One is very easy to treat. One is that you put a tampon in your vagina and you forgot that it was there, and then you go a couple weeks with it in there, and it has blood in it, it has bacteria in it, it has whatever else. If you've been having sex, you can imagine what else is in it. And so it starts smelling really foul. So if you are not accustomed to examining yourself, then you're going to have to go to the gynecologist to let her examine you. So what we would do, we would have basically a room that we use for this very reason, because we'd have to sterilize the whole room afterwards. All we do is put a speculum in, just like a pap smear, look and see what was there, and then use a little blunt instrument like tongs to take the tampon out, put it in a bag, and seal the bag because the odor's terrific, and then we would clean out the vagina with betadine so that it would not have that smell as long as if we just left it alone. That in turn killed the bad bacteria that was growing there, and this is something that could be cause something called septic shock that you probably heard about a long time ago, 20 years ago. Now we don't see it very much. I don't know why. But thank God we don't see it very much. It was a severe disease from tampons being left in the vagina. So that's one reason to have that foul odor. Another reason is not good. Another reason is if you have cervical cancer or if you have uterine cancer. Cancer makes tissue deteriorate, and it smells very foul, and it smells like something's died in there. So if that's the case, and that is so rare, I can't even tell you how rare that is. I hardly have ever seen it except when I've gone to clinics and taking care of people who haven't seen a doctor in 20 years. It's something, in that kind of situation, but it still can happen. And this is not when you just have a bad pap smear. This is something that's been growing and growing and is obviously really bad. When you look at it, you have to go to the doctor, you have to go to the gynecologist, and they have to look at it, and then they have to biopsy a little piece of it and send it for pathology and culture you and see what's growing to see what antibiotics you need. Oftentimes we would have to give antibiotics just because of some of the odor. It wouldn't cure the cancer, and then we would have to schedule surgery with an oncologist, and usually that type of surgery, if it's the cervix or the uterus, is a hysterectomy. So that's a whole nother conversation, but if that is something that you ever experience, it's serious, and it needs to be taken care of right away. Now, the second serious odor is if you have a discharge that smells like fish. Now, probably all of us have had maybe a day of that. Sometimes bacteria from your rectum gets into your vagina somehow, diarrhea, something, and your vagina is contaminated with the bacteria from the rectum, and that can have something called Haemophilus or Gardnerella. My clinic patients used to say I have the garden. So there's lots of different verbiage for it, but basically it is an infection with a bacteria that causes a fishy smell. And that is something that usually is from your own contamination of your own vagina, or contamination during intercourse, where intercourse pushes your own vaginal bacteria into your vagina. Rectal bacteria into your vagina. So that is something that most people are like, oh, I hope I don't have something like that. I'm afraid my husband's been running around and giving this to me. In general, it's not that. It can be that. And sometimes when a woman self-infects from her own rectum, then her husband may have it, and so we have to treat both. But that doesn't mean anybody's been going outside the relationship. It is possible. It's always possible, but that's not what we think of first. So when we have this type of treatment, a fast way to tell if somebody has that is we use nitrazine paper. That's like the paper you dip in urine to see if there's a problem. Now in urine, it should be yellow. In the vagina, it should look yellow, which is acidic. And if you have Gardnerella, then it turns dark blue. So if you have that, we then culture, but we also treat right away and treat you with something metral or flagyl, and usually it's a treatment for both partners. If you don't have a partner, then it's just a treatment for you, but it can be up to 10 days to get rid of that bacteria. I tell my patients to also take a probiotic, or take a probiotic and open the capsule and put it into the vagina so that you can grow the healthy bacteria. That also can make things go a little faster and you get better faster. But as long as you have that fishy odor, you're at risk of infecting your partner, or someone that you have sex with. So that is one of the two things that can have a fishy odor. The second thing is considered a sexually transmitted disease, and that is called trichomonas. I don't know what the other verbiage is, because that's what usually my patients would call it or ask if they had it. So trichomonas is parasite. It's a little flagellated, moving microorganism that actually looks like a huge sperm under the microscope. So we can see it. If we have any question, it turns nitrazine paper blue. But if we have a question whether it's one or if it's trick or it's Haemophilus, then we're going to take a swab and look at it under the microscope and see if something's moving. And we don't confuse it with sperm, because sperm are very small and these are big. So we can see it under the microscope. So that's usually how the gynecologist will take a look and see what's going on. And then the treatment's the same. The treatment is still flagyl or metryl or metronidazole. So those are the treatments that we use, and for the same length of time. In that case, the partner has to be treated, and then when both people are clear and it comes back, you know that someone's getting it from somebody else. That's for all of you sleuths out there who are wondering, that's basically what that fishy odor can come from. Now, I'm going to go back to just smells funny, okay? I usually figure out if that's the smelling funny basically goes along with the discharge, because usually you have some kind of discharge in your underwear. It's white or it's wet, or, I mean, if you are cycling, if you take hormones, if you're fertile, you have some kind of a vaginal discharge. That's how the vagina cleans itself. So you should have something that is cleaning the vagina. After menopause, you're not as healthy. You're not cleaning your vagina. But in general, it's a little painful to have intercourse when you're menopausal and you're not taking estrogen. If you are taking estrogen, it gets wetter again, and you get wet discharge just like you did when you were 30. So it brings you back to a state of more youth in terms of discharge. A lot of my patients go, hey, I didn't know I was going to get discharge again. I kind of enjoyed it when I didn't have any discharge. Well, but they enjoy a lot of other things about fixing their menopause and their low testosterone, and this is something minor compared to that. So if the odor is yeasty, it's like bread-like, it's yeasty, and that's usually a yeast discharge, and it's an overgrowth of yeast. It generally means that somehow your pH balance is off. When we look at the pH, it's yellow, it's acidic, but that doesn't mean that you don't have any kind of yeast infection. That is what yeast turns the nitrazine paper into, is yellow. So it usually is accompanied with white discharge and itching. That's usually a yeast infection. In general, if you don't have the other two things, and it's just a yeasty smell, it's probably not harmful. It's probably not an infection. It's probably just the pH changing and your bacteria changing a little bit throughout your cycle. So I would not go to the doctor for that. If you have yeast infection, you can go over the counter and get Monistat or some of the other over-the-counter antifungals and treat yourself. If it doesn't go away, you have to go to the gynecologist. Okay, a sweaty-like vaginal odor. So, we all have body odor if we have hormones. Usually kids don't have body odor until they start making estrogen and testosterone, women, girls. Men don't usually get it until they start making testosterone. It changes our pH and it changes the bacteria on our skin. And basically, oil from our sebaceous glands under our arms, on the insides of our thighs, those actually create a place where bacteria can grow. And it smells like what people say BO. This is something that is made worse by being wet. It's made worse by not washing every day and not cleaning with soap. And I don't advise using regular soap in the vagina. You can use mild soap on the outside of the vagina and around the outside of the vulva. Around the outside of the vagina, that's fine, but you don't want to irritate anything. And but you should be aware that you can't wear sweaty clothes over and over again. So taking your clothes and throwing it in the corner and then putting it back on to exercise the next day and throwing it in the corner and putting it on to exercise another day is going to possibly create a discharge and an infection. And so you'll smell like body odor. It basically just stays there and lives every time, and it gets worse every time you put that on. You need to wash your clothes in between wearing them to work out. It's just good habits. So same with swimsuits. Wet swimsuits, wearing them all day, that is frequently a problem with yeast infections because yeast loves being wet. But it also can cause you to have body odor, or it can cause you to have a sour smell, like towels that have been used wet and thrown in a corner and they stay wet and they develop a kind of sour smell. That can also be an odor that you smell in your vaginal area. That's not pleasant either. Luckily, all of these things are usually limited. We fix them, and then we don't have to live with them forever. So this is not something that is lifelong. This is just something that you have to learn to deal with when it happens. So the sour towel That's a genetic thing. Some people can't smell it, some people can. I know that my husband can't smell it. He always holds a towel up to my nose and says, "What is this? Does it smell sour?" And I'm like, yes. So it's not something that you can't blame your husband for not being able to smell sour, okay? So you may have this and nobody knows it. I mean, you don't know it, but somebody else does, especially if you're having sex with them. So you may have to listen to them if they tell you that there's an odor and that you can't smell. So usually it's bacteria that grow in wet places, and it usually has some yeasty-like growth as well. So they grow together and they create this lovely smell. So that's something that you have to change what you do. You have to wash your towels and put them in the dryer or something so that they don't stay wet between taking a shower or washing yourself. You also have to wash in warm water, because warm water is what's going to kill this, warm or hot. But cold water sometimes doesn't do anything for it. So you'll still smell it in a towel that's been musty or your clothes that you're wearing. So let's see, musky odor. Musky odor, there are perfumes that have musk in them. They're worn by people who want to attract the opposite sex or the same sex, whatever, but attract someone. Musk is used in the animal kingdom at a time when female animals are ovulating. And so they're trying to attract the male at the right time, so they secrete this musk. Musk doesn't always smell bad, it just smells different. And usually that'll happen in ovulating women. It'll happen around ovulation, and they'll have a different smell that smells a little musky. But it doesn't smell bad. It just is different. There's nothing, it's not an infection, you don't have to do anything. And it's just a normal scent of attraction. So it's usually in cycling people, it's only a day or two in the cycle. Some women who take testosterone kind of have this musky kind of odor all the time. And that's not unusual and that's not bad. The next one is if your vagina smells like urine. So if your vagina smells like urine, you haven't changed your underwear, or you've had a urine loss, or the vagina can smell like urine even if you are not losing urine that day, but it may have gotten into the vagina, kind of set up shop, and the uric acid is smelling. So that you would have to wash really well and then take care of whatever is causing you to have urine loss. We have a machine called Emsella. We put people who have bladder laxity or pelvic floor laxity and have urine loss, and we put them on this machine, and it does 1,500 kegels in 20 minutes. And it strengthens the muscles that hold the bladder tight so that it doesn't lose urine. And it recreates the angle of the bladder that kind of falls down. It brings it back up so that you're more continent. There's also surgery for this if it's severe, and there's also, if you start taking estrogen or even estrogen cream that is in the vagina and right around the urethra, that will strengthen the bladder and make you less likely to lose urine. But that's a smell nobody wants to carry around. So it is something that people ask me about. Last but not least, people who are in nursing homes have just a different odor, partially because they take a lot of medications, and medications can make your body smell differently. But vaginal odor, like a nursing home, is basically the odor of not having any hormones and not having any cleaning of the vagina because there's no discharge. So the vagina gets dry, and as life goes on, by the time you're 80, if you haven't had any hormones, maybe even 70, your vagina is about this big. I could barely get a Q-tip in patients to try to do a pap smear. I certainly couldn't put a speculum in if they'd gone many years, over 10, without having any kind of estrogen and no intercourse. If they have intercourse, it's going to tear because it's not stretchy anymore. You need to have hormones present in the vagina, either topically or through your whole body, so that you can stretch enough to have intercourse. So without it, you have a funky smell. And there's not much you can do about it except add some hormones and maybe some probiotics. They now have probiotics that you can insert into the vagina. But I think that would work better if you had estrogen. And if you have a very tiny vagina, because it's shrunk, it's going to be hard to put anything in there. So these are questions people ask me that I don't think everybody really understands. The background or why or what to do about it. So I hope that this has given you courage to ask your gynecologist about whatever is worrying you about the smell of your vagina, your discharge, any unusual bleeding, of course. But please trust your gynecologist to know what to do with this, because that's what we're trained to do. And we should be talking to you about this and fixing whatever is ailing you, but we can't fix it unless you tell us. Or it's really obvious to us. So thank you for listening to me. I appreciate you listening to this it's a touchy area. But you need to know some of these facts if you're the owner of a vagina. So I will talk to you next week about another interesting subject and another set of questions that patients are too embarrassed to ask their gynecologist.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. You can find Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth.